Hello, thank you for taking the time to listen and stop by. My name is Ali Ephraim Sutherland, and I am a student at Westfield State University. The goal and intention of this podcast is to give a guide and some resources about the role of the non birthing parent during the pregnancy process. You're probably thinking that this is ambitious and broad for a short podcast, and you are correct. There are going to be things that I do not touch on, such as cultural differences that different families partake in, and how that plays a role as a non birthing parent. I also will be focusing on becoming a parent in the United States. Even with that in mind, I will not be focusing on individual states. Now to the question at hand. How do you think about non-birthing parents' role during conception to postpartum care, and what are actions you can take to improve the outcomes for everyone? I'm going to be focusing on some concepts that will help the non-birthing parent be aware of what to expect. I will be breaking down this episode with the focus being on two time periods, birth and postpartum. Discussions on identity, shifts, reaching out for help, and the shifting of mental load and the importance of mental health throughout the process are going to be things that I will touch on as well. I also ask that you please forgive some of the generalities that are going to be made. First things first, congratulations that you are embarking on this journey. I hope that I can help you to think of some things that perhaps hadn't crossed your mind or can be a nice refresher of goals to accomplish as you move toward starting your family. Let us begin. The intention of this podcast is to help the non-birthing parent. Though you might hear about occurrences about teenage pregnancies or couples able to conceive with little effort, this may not always be the case. This also doesn't take into consideration the health of the baby or the birthing parent. Often regarding healthcare, there is understandably a lot of focus that is placed on the birthing parent. This is rightly so. There's still a role for the non-birthing parent, and though our institutions and practices are not equipped for that model of care, you're going to work toward that direction. Let's start by briefly speaking on the preconception phase, or the time before there is a fertilized egg. This is the time that you are going to work on getting your home in order, figuratively and literally. When it comes to things for preconception, you're going to want to get your body as healthy as possible. This means that you're going to need to make sure that the non-birthing parent is vaccinated to ensure that you are reducing the chances that either parent is sick during this time. You're going to want to consider your eating habits. You want to be caring for your body. You want to start working to be physically active. The goal is to not be an athlete. You are trying to improve your health and help with the marathon that is having a child. Your lifestyle is going to change because you have a child. They are going to take center stage. I am not saying this to be condescending. Anecdotally, from speaking with parents, they have all mentioned one thing. The support almost falls away once you have a child. The consistent visits to the medical providers will all but cease. Family leave, which, by the way, make sure that you are speaking with your employer about this as soon as possible, only lasts for so long, if you have it at all. If you are fortunate, you potentially have family that can assist. However, a large portion of this will fall on you and your partner. If you are hoping or depending on family to help, one, make sure that you are aware of what that looks like and if they will be able to help at all. Have a backup plan of childcare and put yourself on a wait list in case they are unable to. Insurance in America is tricky. The moment that you are planning or know that you are going to have a child, it is in your best interest to know what is covered and what is not covered by your insurance. What are some things that you're going to have to pay out of pocket or have copays on? Does your insurance cover breast pumps? What about vitamins that the birthing parent in your relationship might be recommended? An example of something to consider that may not be covered is working with a genetic counselor, a doula, or a midwife. It is important to have a conversation with your partner if this is something that you're interested in. Because if you are, these are expenses that might have to come out of pocket. I'm outlining things that are to take into consideration with the resources that you have available. The closer that you are to the baby coming, the more you're going to want to have prepared. So it's best that we start working on these things now. Once they are here, it will be more harder to operate and another person to add to the mix. There are different healthcare providers that you might meet or at least have the option of meeting. Not all of these are required. However, it is crucial to have a talk with your partner about these different options. Being invested in what happens will help to ensure that there is more control of the chaos that is pregnancy. Also, it gives an opportunity for bonding, communicating about your future. A genetic counselor is going to be there to help with screening tests that can help to determine the risk that the child once born would have. For example, any congenital conditions such as Down syndrome. They can help to determine what the likelihood is of the child having certain conditions, allowing for earlier decision making of the parents. The physician is a medical provider that, if nothing else, you will most likely see and have heard of couples using. They are going to help, especially if there are any complications. This can be complications that are with the birthing parent or the fetus. A midwife can help with a positive start for breastfeeding and help with other prenatal care. A doula is an optional medical practitioner that can help be an advocate while the birthing parent is giving birth by helping with breathing techniques and helping to give extra attention to the birthing parent and you as they deliver. These are all medical professionals that are helpful. However, depending on where you live and your financial constraints, this might be difficult or unavailable to you. The earlier that you speak with them about their services and the way that they can fit in with their birthing plan, the better. In some cases, your insurance might be able to cover some of these options, but that is unlikely. So again, by speaking with these professionals sooner, you can try to work out different options and see what works best for you and your family. Let's talk about how you are going to get ready for the arrival of the baby specifically. You need to learn how to hold a baby, change a diaper, burp your baby, calm them down, baby-proof your home, perform some basic baby care and first aid, install a car seat, and swallow the baby. You're also going to need to get some baby equipment. Are you each going to have or want your own bag? Are you going to have disposable or cloth diapers? Are you potentially going to have a diaper wipe warmer? Setting up what your diaper changing station would look like is also important. The nursing room is another activity that could be used to bring you and your partner closer. It cannot be stressed enough that now is the time for you and your partner to work on communication. Two of the things that you certainly do not want are crib bumpers, because they have been proven to be dangerous and lead to suffocation and death of infants. Also, you will not be buying inclined baby sleepers either. You are not to have a baby sleep in the bed with you, but you are more than welcome to have them in a crib in the same room as you. Also, now is a great time to look into baby monitors. You are going to need to deep clean the house. The closer you get to the time of birth, the more important this will be. This may very well be the cleanest that your home will be in quite some time, so enjoy it while it lasts. Which leads to the point about who will be doing what. Which person will do the feedings at night? What about cooking and laundry? What does your schedule allow? What do you roughly think it will allow? Assume that you are going to have less time, and the time that you have together, you are going to be more sleep deprived. Keep this in mind regarding how long your commute to work is. What are the work-life balances going to be in the family? Are one of the parents going to stay home? Have open communications about what each other's needs are and find ways to compromise. Understand what each person is asking for and why. How can you make amends and come to terms with the new life that you're going to have and some of the things that you need in order for you both to coexist and live happily together. I'm going to rapid fire some things that are important. You're going to want to ensure that you understand what family members are going to be able to help, if any. I know that this was previously mentioned, but it is critical that you and they are on the same page. The CDC offers a guide that is available to ensure that your child is meeting the developmental milestones. There will be a link for it in the description. This will help to identify things and help you so that when the child is going in for regular checkups, you will feel more prepared with either questions, answers to questions, etc. I also feel that it is important to repeat family medical leave varies based on job and state. Ensure that the moment that you know that you and your partner are going to have a child, you begin the process of ensuring that you have family medical leave ready for once the child is born. Based on where you live and who you work for, this might be a possibility for you, or it might not. If so, understand what you must do to make sure that they get it to you. If you unfortunately do not have this as an option, then it is imperative that you prepare. Children are expensive. Take time to see how your new financial situation looks like with a little human involved. Having a child is hard, but pales in comparison to the marathon that is raising a child. Do yourself a favor and ensure that you have a plan for who is going to do what, and if you have family, if they will be able to support. Call up your insurance company and ask them if they cover birthing classes, what you need to do to enroll your child. This leads to my next point. In the journal article, The Invisible Men at the Gate of the Delivery Room, The Fathers, What They Feel, What Do They Want, by Atkin et al., it states fathers who were interviewed after their wives had children, there were 4 themes that were consistently expressed. One was how they reacted to the birth of their child. Second was how did the childbirth experience go, and if they were able to be with the mother of their child. Another was what they were expecting to happen throughout this moment. And lastly, fathers were asked if they had any recommendations for any of the prospective fathers to come. Let us first speak about some of the emotional reactions that some non-birthing parents experience. Expect that you're going to have different emotions that start to arise throughout the pregnancy. Many of the fathers that were in the study believed that they did not truly feel as if they were a father until they held their child in their arms. This may be the case for you. On the other hand, you might actually be there already. It might take some time after the baby is born. Either way is fine. It is noted to be a gradual feeling that comes over time, and every person is going to be different on when this feeling begins to take shape with them. Some fathers that were unable to be in the delivery room felt disappointed that they were unable to be there to support the mother of their child. To avoid some of the negative outcomes, have an open dialogue about what the birthing process will look like. Are you going to be in the room? If so, can someone else join you as well? It is important to understand what the plan is for the delivery. If you can be there, what does that look like? What are the expectations? Is there a limit of who is allowed in the room? Ideally, along with getting answers to these questions, you will have a chance to see what the facility looks like that the delivery will happen in. Mental health. The goal here is to talk about what it means for us to change into being a parent and preparation for that inevitability. There are 4 separate themes that fathers experience after their partner gave birth. The fathers they spoke with mentioned having emotional experiences. They mentioned that they felt overjoyed and that it was the most important thing that they could do. They spoke about what it felt like to have expectations of what it meant to be involved and how it felt to be in a space that potentially does not feel as if they are welcome. And what they recommended for parents to be was to be involved as much as possible. The goal is to have an experience that is good for both parents. Some things to keep in mind is that there's going to be some tests that are going to run on the baby once they are born. Some of the tests that they may run are testing the blood of the umbilical cord for the purposes of cord blood banking, which is used for stem cells. If the baby gets sick, the baby is tested for congenital heart conditions, vitamin deficiencies, the APGAR score, among other conditions that are critical to catch early. Discussions that you as the non-birthing parent need to have with the birthing parent are whether you will decide to keep some of the umbilical cord blood for stem cells if possible. And if your child has a penis, will both of you decide to get them circumcised? Here are some of the things that fathers recommended on what to do during the labor process. One that all the fathers in the study endorsed was try to take part in some form of birthing class beforehand. They all thought it would be best to even do one day. By helping through the pregnancy, and it is noted to help lower levels of depressive symptoms. Another study mentions that with the chaos of the birthing parents' hormones returning to their levels before they were pregnant, it can lead to shifts in emotions and mood. Inevitably, this is going to affect a new family unit. Thus, it is important to be aware that this will happen. Ensure that you are making time for yourself and your new family. There might arise a need for you or the birthing parents to go to therapy either together and or separately. It is important to recognize that there is stress with being a parent and that you cannot plan for everything. Postpartum depression can happen in the birthing and the non-birthing parent. The symptoms tend to show up later after the birth of the child in the non-birthing parent than the birthing parent does, so keep that in mind. It can happen, so make sure that you are taking care of yourself. So far in this podcast, I have discussed the non-birthing parent's role in regards to pregnancy. I find it necessary to reiterate that this is a brief summation of the literature on this topic. I wanted to keep this podcast brief and something that did the most amount of good for the most amount of people. To conclude this podcast, I am going to touch on a more difficult topic now: abortions and miscarriages. There are some misconceptions about abortions and miscarriages. For one, miscarriages, when they do occur, tend to occur during the first trimester, though this is not the only time that it occurs. Miscarriages are classified under different names, such as clinical miscarriages or biochemical miscarriages. However, for the brevity of this podcast, I'm going to be referring to them all as miscarriages. About 10% to 20% of all known pregnancies end in miscarriage. Most miscarriages, around 80%, happen within the first 13 weeks of pregnancy. When dealing with a miscarriage, which happens early in the pregnancy, stillbirth, which is later in the pregnancy, or an abortion, no matter where the birthing parent is with their pregnancy, is difficult. It is important that when this happens, or if this happens, that you do not blame yourself or your partner. Supporting each other throughout this time is important. The life that you have with your partner ideally is a journey, and unfortunately, if this does occur, the best way to manage the pain is together. In order to not leave on such a somber note, there are some last things that I'm going to want you to consider. This is a stressful, chaotic, beautiful time. To represent that, maybe create a scrapbook to share with your kids as they get older. Maybe invest in a Polaroid camera for this. Take pictures and make memories about this time. You will make mistakes, and that is okay. You're well on your way if you found this podcast. Some last things that I can recommend are some apps and a book. Daddy Up is an app that helps with understanding what is happening during the birth process. Contraction Timer helps to let you know when you need to head into the birthing facility that you and your partner have chosen. Pro Daddy helps with understanding what important events are coming up and why you are doing them. This helps to follow along with the time of the pregnancy. The last app is called Tiny Beans and is used so that you can have a place to store the pictures you are taking with your child. The book recommendation that I have is called Pregnancy Guide for Men by Eric Parker. This book gives helpful advice that would be useful for non-birthing parents and is a month-by-month guide of what further events to expect. Thank you for allowing me to be a part of your journey. It means a lot to me. Thank you for your time and your energy, and best of luck in your future.